So, guys, if you don't know, this is Dr. Shaan. He is a Imperial graduate, now doctor and aesthetics practitioner as well in West Yorkshire, now London, right?
Yeah, so we're going to be opening up a clinic in London from April. So really exciting times.
Yeah, it should be good for you, man. Hopefully it goes really, really well. What are we talking about today? Should we tell the guys?
Right. Yeah, so we had a quick brainstorm a couple of days ago, and I thought it'd be a really interesting idea to talk about taboo in the aesthetics industry. In particular, I wanted to talk about the Asian community, particularly kind of background of Indian, Pakistani, that kind of thing, and talk about how, in my experience, so it might not be the same for everybody else, but in my experience, there's been an element of taboo around getting dermal filler and Botox treatments. We want to talk about that, but also how it compares to dentistry, how it compares for men, and other treatments as well. And whether we think it's right, or what is the honest truth? Is it right? Is it wrong? We shall find out.
That's it. So basically, I called it Taboo in Aesthetics as a catchy title. Should we define what we think a taboo is, so we're all on the same page here?
Yeah, I mean, so when I say taboo, it's something that's kind of not spoken about openly in society, and like a common way people think of taboo is like sex, for example, in the Asian community. People don't like talking about it. Money is another thing. Like people don't like talking about money in society, and obviously it varies, right? So in different communities, people talk about different things and have different taboos. And then what I've noticed when I was kind of doing aesthetics, and I've set up in a clinic in Bradford where predominantly a lot of clients are Asian background. I was finding that people were very much interested in treatment. They were really looking forward to getting treatment. But they always would often say to me, Shaan, please don't post this anywhere on social media. Don't tell anyone that I've had treatment,
Yeah.
And they'll often say, like, give me treatment so it looks like I've not had anything done. So they were kind of hiding it from the world, really. And I just thought that was really interesting because when you compare that to other clients that I've treated from predominantly a Caucasian background, for example, they'll often bring their friends with them. They'll often bring family with them as well. Mom and daughter get treatment together, for example. And I just find that really interesting how there's a huge disparity between cultures when it comes to injectable treatments. And so I thought it'd be a good talking point. I wanted to kind of nail down a little bit about why is it that aesthetics is well, when I say aesthetics, I want to say dermal fillers and Botox because that's what I've had experience with.
Yeah.
But why is that a taboo? And also, I've just done a quick poll on my page today. And I think like 85–90% of people kind of agree that there is a slight taboo in the Asian culture for cosmetic procedures. So I want to get your opinion on it and kind of what's your experience been with this industry?
Yeah, for sure. And first of all, thank you to Anissa who's bought a badge, which is what supports basically all the live stuff that we do. So thank you for that. I think it's definitely something in there that, certain cultures have maybe they're a bit, they want to keep things at arm's length almost in a way. And it makes sense. And sometimes maybe you're talking, people don't want it to know like it's been done. And that can be like, okay, well, I want it to look natural, but also at the same time, it could be, oh, well, like you say, people don't want other people to know something's been done because they might get comments from family members, etc., or members of the community. So yeah, I think that's interesting because, like you say, a lot of the people who inquire about treatment from yourself are from Asian backgrounds, and it seems like the poll that you put up was, what is it, 86%, or like
86%, yeah,
saying that, okay, well, they don't, they think there's certain stigma attached to having this treatment done. So yeah, I think it's definitely there. The why is probably different in different circumstances. I think there's probably some religious reasons for some people, and that's probably different across a number of different religions as well. And then culturally, maybe, I don't really know about the cultural side. Have you had any comments as to why that might be?
So it's hard to say. And like when I say culture, obviously it's such a hard thing to define, right? And I think different cultures have different takes on aesthetics as well, even within the same religion, for example. So, like, a really good example that always comes to my head is that, some Muslims will say that you shouldn't get, dermal fillers or Botox. But then equally, if you went to somewhere like Dubai or, UAE, it's really popular there, where predominantly, the people, the population is a Muslim country there. So even within religion, lots of different cultures have different takes on it. And that's the kind of thing that I want to kind of dig deeper. Is it that, what makes this culture a certain way? And another thing that I'm actually finding quite interestingly is the age group disparity. So a lot of the older clients like to hide it a lot more. But actually, some of the younger clients are kind of on board with it, don't mind sharing on social media, and actually like to talk about it as well. So I do feel as though it's getting normalized a lot more. When I say it, I'm talking about dermal fillers and Botox, and we'll come on to the other kind of treatments.
The whole world around aesthetics, which is beyond just simple injectables. And guys, we want to hear your views as well. So if you've got any ideas about what it might be, please hit us up in the comments and we'll look to read as many out as we can. I think part of it is to do with if you had this idea of a shame culture versus a what was the other word for it? So there's some people who've got shame, they get shamed about things, and others it comes from inside. The word for it is losing me just in the air, but it's that idea of that actually what the community thinks is a big issue in a shame culture, and then what you think in the other side. So maybe Caucasians think about what they think of themselves more than an Asian culture might think about what the community would say about things. Zaki is saying, I've been considering Botox, but worried that she'll end up looking like Sylvester Stallone's mum. I'm gonna have to Google Sylvester Stallone's mum.
Yeah, I mean that's kind of a pun there.
Sylvester. Okay, the female version of Sylvester Stallone. Okay, I get it. Okay.
So look, I mean, look, it's one of those things where it's different. Like you said, it's like that shame culture. You don't want people to it's embarrassing if people know that you've had treatment, and that's probably one of the reasons why they want to hide it. So I understand that side of it, but I just find it interesting how there's within different cultures, there's different takes on it. And then also, really interestingly, different treatments of dermal fillers, I find have different elements of, taboo associated with it. So a really good example is a non-surgical rhinoplasty. So some people, particularly guys, don't mind that treatment at all. They're like, that's completely fine, really happy. I just want to correct my nose, and it's more seen as corrective work. Whereas enhancement work, so getting bigger lips or whatever, is always the taboo topic, and that's what I find quite interesting. And then there are also treatments that guys think are slightly feminine, so they don't want to get that done. So I hardly ever have men that get lip fillers. It's quite rare, really, and it's quite rare to have certain treatments for men that that women might not necessarily have either. So again, within genders, it's so much taboo that's so specific to certain people and certain types of people as well. So that's the interesting thing there.
Do you think it's partly down to a change in style or a change in fashion as well? Because if I just think about people that I know, as a dentist, you work with people who are now 10 years younger. Some of the nurses are 10 years younger than us, and the kind of style or aesthetic they go for is very much not a natural look. Do you think that's maybe, I don't want to say helping, but changing how people see things in different cultures as well?
100%. So like the society that we live in, what's advertised is such a big deal on how the look that people want to achieve. And I would easily say, like 10 years ago, lip fillers, before Kylie Jenner, really, they were not really a big thing. And social media has kind of just put that into overdrive. We did have fashion before social media, but nowadays you see people, see celebrities, you see even your friends on social media posting, new lips or, just had this done, whatever. And then that just kind of makes that normalizes it a lot more for one reason. And that's probably one reason why, like, the older society, in particular in the Asian community, haven't kind of they still get the treatment done. Like, don't get me wrong, it is kind of done, but it's all done hush hush. It's all done behind closed doors. And so that's probably the reason why it's just kind of, it's a bit more normalized in the younger generation.
Yeah, Carolina's saying you need to know what kind of patient you're dealing with, which is true. And Zaki is saying that filters on social media do not help things at all. And I think that's really key, because you can see, a person in the daytime in person, and then, okay, they post something online, you go, I kind of recognize that person, but it's only by seeing the username that I know it's the same person, and then that can be a whole sort of vicious cycle of people are wanting to look a certain way and don't realize that actually there's some crazy filtering going on, and a lot of makeup, and then cosmetic stuff going on as well.
I guess, like, with social media, and this is a completely different topic altogether, is that people will they're always trying to portray themselves in the best way possible. And it almost turns into a big contest, really, of who's got the best life. And so you've got to be really careful and just be aware of that when you're on social media, to be like, and to, give yourself a bit of a break and say, it's okay, I'm okay. And I read a really funny meme the other day, which said that social media has 23-year-olds thinking that they haven't achieved anything. And it's just like, it's so true. Like, when you're 23, you probably haven't achieved a lot, and it's normal. But you see social media, so many people do really well, not just in the way they look, but also on materialistic things as well. And it can get people feeling down, and that's the kind of thing I think with the aesthetic industry, focusing on that, is that people portray themselves looking really good, really beautiful all the time, and they kind of can instigate people to want more and more treatment done, really.
Yeah,
so you've got to be careful.
Again, it's completely off topic, but I saw a video. I was on YouTube just randomly searching stuff, and I saw a video of one of the Paul brothers, and it was an old video, and he was about 7 years old, and that guy's been doing videos since he was 7 or 8. Like, of course, he's got now 14 years experience in the industry. Obviously, he's 14 years on. If you're starting today as a 20-year-old or something, you're going to be 34 by the time you get that level of experience. So it's like, okay, well, where did you start from? And there's been some serious effort gone into that personality and everything that he does and stuff like that. But that's the same with all the side. So let's get back on topic. Specifically towards aesthetics. Do you think it is a kind of with social media, people looking to be a bit more outrageous and look a little bit more crazy, or a little bit more out there than the next person, and it's driving everyone into this crazy kind of overdone sort of lips and cheeks, etc., etc.? Do you think that's something that's happening?
So it could potentially be a reason why. I do feel that the people that get kind of huge lips, in particular, if you're talking about huge lips, tend to be people that have kind of lost track of what normality is at that point. And I think that's a separate issue. I think it's not the norm. I don't think most people go for lips that are massive and really big. I think it does tend to be a minority of people, and I think for them it's because they've lost their idea of normality. So they feel like their lips aren't big enough, and so they need to get bigger. And all you have to do is show them a picture of their lips, 4 years ago, 3 years ago, and then they'll realize, oh my God, I've had such a big change. But I do think that's the minority of people.
But it's more in terms of like the taboo side of things. Let's say the aunties are seeing those come up on their WhatsApps when they're at, and they're seeing, okay, this is what aesthetics is in their minds, as opposed to more corrective changes here and there for what the kind of thing that you might do is completely alien to them. So in terms of where the taboo comes from, maybe that's driving it.
You're spot on. Yeah, you're 100% right. And also, people, read a lot of newspaper articles of lip fillers gone wrong and lip fillers overdone, and it does happen. Unfortunately, there are cases where it happens, and they get kind of portrayed in the news loads. And it gives lip fillers, for example, or dermal fillers in general, quite a bad name. And that's one of the reasons why I think there can be a certain taboo in certain cultures. I don't think that's really the cultural reasons as much. I think that's more the society as a whole, really. But yeah, I kind of agree with that. You know, the way fillers are portrayed sometimes can be negative, which is not necessarily a bad thing because it gives a bit of realism to it. You know,
Yeah.
if things go wrong, people will think twice about getting treatment done that they might not necessarily need or understand very much. But yeah, I do feel like it does get a little bit of bad press, and that does, you know, create a taboo about it already.
Yeah. Carolina is saying some people go for different reasons. Some like to look like other people, and other people go just to get what they need. It depends.
Mm.
Somebody else is saying, does getting cheek and lip fillers change how you look?
So, I mean, the obvious answer is yes, of course it does. You know, that's the
Yeah.
whole purpose of it. If it didn't change the way you looked, you'd probably want a refund, and you know, you'd be quite unhappy that you paid money for treatment that hasn't worked. So yeah, the answer it does change the way you look, but the question really is how much do you want to change, and you know, do you want a small subtle enhancement? Do you want huge, you know, massive cheekbone thing? And that's a different conversation topic. One comment that I really like from Zakia is, you know, do what makes you happy. And
It's a
that's a
bit further
really
down. Yeah, that's a little bit further
bit
down from them. Yeah.
bit further down. And I think it's a really good comment because, you know, it is so much truth in that. Like, do what makes you happy. Um, and I think that's where you know, the importance of a trustworthy practitioner comes in. So if what makes you happy is getting huge lips, well, actually, you might be going down the wrong road here. And so someone just to rein you in sometimes is not necessarily a bad thing. But yeah, I think there's a lot of truth in, you know, do what makes you happy. Don't kind of buy into the prejudice and the taboo of society, shaming culture, whatever. Maybe don't buy into that as well.
She's also said if it's great if you're blessed with good genes, but it comes a point where you get to an age you might need a gradual aesthetic enhancement, and there's
Mm.
maybe nothing wrong with that. Somebody else is saying she's got fillers but kept it natural and really happy with that. So yeah, that's great. So loads of comments. Sarah saying comes down to body confidence and self-esteem issues. So bigger is not better. Self-esteem is a huge thing, and obviously we're seeing a lot of talk this week around self-esteem, aren't we, with Meghan Markle being potentially bullied in the royal family. That's again, we've heard some pretty horrific things there.
Mm.
How big is it within the aesthetics industry? Do you see people coming in who, in your opinion, maybe could do with some CBT or behavioral therapy before they go in and do some aesthetics?
I think it's a really interesting point you raise there. And I don't want to talk about the, you know, private aesthetics first. First, I'll talk about
No.
kind of dermatology and the NHS to begin with. So in the NHS, a lot of treatments that we don't really do much treatment for cosmetic stuff, really. Very occasionally, you can get a treatment done on the NHS if it is affecting someone's mental health to an extreme amount. So, for example, it's almost impossible to get laser hair treatment or laser skin treatment on the NHS. Very few cases I've seen happen, you know, very, extremely rare is for, you know, those kind of reasons like mental health reasons. So there is an element of that definitely, you know, that where sometimes actually the treatment isn't really to do the aesthetic work, but actually to treat the client's underlying, you know, mental health issue that's causing
Yeah.
them. So that's one thing, just to clarify there, and also just about in the NHS as well. You know, it's it's almost hands off and completely forgets about that sector, and something that I kind of agree with that, you know, perhaps the government and the public shouldn't be funding people to have treatments to enhance their beauty or enhance their, and it kind of I'm working in dermatology at the moment. It's a really fine line of where you draw the line there. So if you've got a mole, for example, and it's harmless, should the NHS remove it for you, you know, with laser, you know, the laser treatment, or, you know, a biopsy, or, you know, a shave excision? I don't think so. I think that shouldn't be the taxpayers' money going there.
Well, I think you got to. Yeah, I think you're right. But I think in that kind of situation, you probably look at the service as a whole and go, well,
Mm,
actually, we haven't got enough funding to deal with cancer, for example.
exactly.
We're not going to do skin tags or a mole, you know, benign kind of conditions with no malignant potential if we've
Mm.
got big time stuff still needing doing.
Absolutely, yeah. So look, so in the NHS, there's an allocation resource problem, right? Everyone knows that, and
Mm.
you shouldn't really spend money, which is not necessarily a medical treatment, and you're taking away money from what could potentially be a life-saving treatment somewhere else. So yeah, I think it's a really interesting point in terms of, self-esteem and moving, what people should and shouldn't get done, really.
Yeah, I mean, well, shouldn't get done on an NHS sort of or a publicly funded sort of thing. I suppose
Mm.
the line becomes, what you should and shouldn't get becomes much more broad once you're paying for it yourself. But again, I still think there's probably boundaries at some point
Mm.
in that debate as well, and maybe. I think, you know what, let's talk about the reversible and irreversible things as well, because I think that's an interesting conversation. Do you think there's a difference in how people look at certain treatments, for example, surgical versus non-surgical rhinoplasties?
Mm.
You're talking about hair removal as well, and
Mm.
things along those lines. How do you see that? Is there a difference there?
Yeah, 100%. So, plastic surgery has a huge taboo with it, almost because it's permanent, for one thing. It's a permanent change to your face or body. And it's almost saying, I don't like this anymore. I'm getting rid of it or changing it forever. So it's a big statement to make, and it's almost it's very difficult to go back on that.
Mm-hmm.
And it's got a huge taboo because it's almost it's a very expensive procedure. Not many people can afford it. It's a huge change to face or body. And it's almost reserved for like the elite as well. Plastic surgery is not very common. And I think that's almost why it has a bit of a bigger taboo, because most people can't afford to get it done. And that's kind of where the non-surgical stuff's come in, like
Yeah.
lip fillers, or Botox as well. It's much more attainable for the average person to get treatment done. And so it's normalized. So more people can have it done, and therefore, it's a bit more normal in society. But also, like you said, it's reversible. So there is that element of, actually, if I don't like it, I can get rid of it. Or actually, Botox will wear off in 3 months or whatever. And there's that element of lower risk as well. So
Yeah.
more people are willing to dip their toe into it as well. So if you held like a room of 100 people, you could ask them, have you tried lip fillers? And a lot of people will say, yes, I've tried it, just because of that element of lower risk in that sense, because it is reversible. Not that I'm recommending that you should reverse fillers willy-nilly.
Yeah.
Just want to make that clear. But I think that's one of the big reasons why people are happy to kind of trial it and dip your toe into it.
Ms. Meraki saying, I think it's something to do with vanity potentially. People have had highlights in their hair and then had said the sun lightened it. That's a good one. I'll use that. I've had family say that focusing on looks will mean you don't care about education. So some people may be thinking that focusing on your appearance is vanity. And that's why something that changes your appearance becomes taboo. I think you're probably right there as well. I kind of dislike that whole sort of idea of someone who looks after themselves or focuses on their appearance is entirely vain, because I think a lot of the world is run on first impressions. First impression really matters, especially in how, for example, and this is kind of on a slightly adjacent topic, fitness. Because I was at school with you, that I was a very skinny kid up until time university, and you start to fill out, and I filled out quite late. So I felt in adult situations there's a big difference how I was treated around peers, from when I was skinny little 60 kg 55 kg guy up to mid 70s to going towards 80 kgs. I think there's a big difference in how people respond to you, and I wonder whether it's the same for girls as well. It's very difficult as two guys to understand how social kind of cues work for girls, but I don't know if that's similar.
Yeah, no, well, look, I kind of have a different approach on it. Maybe it's not how other people see you as much, but how much your self-confidence grows.
Yeah.
And that's a big thing in aesthetics, right? So it's the same like for a guy, if you've got a new haircut or whatever, and you're feeling good about yourself, or you've been to the gym, you look after yourself, and you feel good. And you might think people are treating you a certain way, but actually your confidence has increased, right? Your self-belief has increased, and suddenly you think, whenever you meet people, you're more confident, you're speaking better, you're talking to more people, you're engaging with you better, and that could be that just transferring back onto you effectively. So possibly people treat you different, you know, and I do think there's an element of, you know, good looking people might get treated slightly better than, you know, someone who's slightly, you know, worse off looking. But I don't think that's kind of the main reason why people get treatment done. I think it's more to do with themselves, and you know, with their own self-confidence and self-esteem. And I don't think there's any harm in that, but I do feel, and I kind of why my the kind of our page is, well, one thing I really try and focus on is that, yeah, fillers and Botox can be there to improve your self-confidence, but they
Yeah.
shouldn't have your self-confidence should not rely on fillers and Botox. It's kind
No,
of
no, for sure. I think I think your point there is really good there. I think you're probably right in saying that maybe in my situation there was somewhere in between. You know,
mm,
certainly self-confidence will improve. You know, the fitter and stronger you are. But I think also people do probably treat people
mm,
differently depending on what they see and hear. So it's
mm.
probably a whole um, never-ending circle of up or you know how that changes that change of
It's true. I think it's what like an unfortunate reality of life, and if you're really honest about it, I think there is an element of truth there that, you know, slightly better looking people probably have people respond to them better. You know, that makes them happier and they have more friends. You know, there is an unfortunate truth in that, which isn't necessarily right, but I think, you know, the reality is that it possibly is that way. One thing I want to talk to you, obviously, you're a dentist and your page is, you know, Dentist of Instagram, is, you know, why is it that dental cosmetic procedures, such as teeth whitening, such as, you know, composite bonding, is way more acceptable? It's kind of a lot more, you know, a lot more men get treatment done. Why is that, as opposed to dermal fillers and Botox?
um, I think part of it maybe, and this is probably maybe step one in a whole number of things. If you're going to the dentist, you're already there for a health checkup, right? Have
Hmm.
you got decay? Have you got some gum disease? Check for an oral cancer, that sort of stuff. And then
Mm,
if a dentist is also offering cosmetic treatment on the side, it doesn't feel like a big leap. Whereas
mm,
maybe an aesthetic medical clinic or something like that, there's no other reason you're going there. It's not like, oh yeah, can you just check on X, Y, Z, and while you're here,
yeah.
you know, it's like going to the barbers. You know, you get your hair cut, and then you end up getting a head massage and you know, stuff flamed off your ears, and they do
Mm,
your waxing your eyebrow. You know, whatever else they're going to do, they sell you a little bit extra, but you're already
yeah.
there, and it doesn't feel
Mm,
like a big leap to then get
mm,
the next thing and the next thing. So maybe that's part of it. But I do agree, because I mean, I get people messaging this page relatively often, and it's an impossible question. Uh, Something like, "Do I need braces?" And usually I say, "Nobody needs braces. Do you want them?"
yeah.
It's you know, nobody needs whitening. Did you want it? Nobody
Mm,
needs veneers or X, Y, Z. These are things that you can kind of do without. It's
mm,
um, it doesn't have to be done, you know. And a lot of these
mm.
things, you're right. It's a very funny kind of double standard almost in a way, isn't it?
No, I think it is a bit of a double standard, because the reason why I think it's a double standard is because it's equally as invasive treatment as well. You know, you could argue that, you know, a haircut or whatever is superficial, but an injection into your face is an invasive procedure. But then you look at composite bonding, you look at kind of local anesthetic being applied, and it is very much an invasive procedure, but actually a lot more people are willing to get it done, and there is less of a taboo, and it's kind of more actually acceptable, really, in society. So I've always wondered kind of how that has managed to sneak its way into the way of aesthetics and not being a taboo and not kind of being, you know, frowned upon,
Yeah,
almost.
it's. I think it's aesthetics as a whole profession is very new, and dentistry is
Mm,
obviously very, you know, there's some dentists like say it's the world's oldest profession or something, you know, which is probably
mm,
nonsense. But yeah, I think you're right there. Maybe part of it is, oh, white teeth is seen as clean.
mm,
You know, so whitening, oh, the whiter it is, the cleaner it is, which
yeah.
is again nonsense, because
Mm,
you know, teeth have a natural color, uh,
right.
and then you have, you know, yes, you can whiten it, but you know, is there any tartar in the back of the teeth? And again, you know, clean that off doesn't mean your teeth are going to get whiter. It just means that all the stuff that was stuck onto them is now gone. But maybe that's part of it as well. There's always this kind of idea of whiter is cleaner. You know, think about wedding dresses, classically white, or, you know, that kind of thing. So maybe there's some sort of societal thing there going, you know, down the ages that.
Yeah, no, I agree with that. I do think there's an element of cleanliness, and you know, it's a medical treatment, you know, going to a dentist. But from what I've seen, a lot of the dental treatments tend to be, you know, a lot of cosmetic procedures as well. Even fillings, for example, there's an element of medical kind of aspect to it. You know, it is a medical treatment, but then you can opt for a private filling with a, you know, white composite, which is covers the skin beautifully, you know, and you don't have that metal aspect hanging, you know, showing on show for everyone to see. So there is always that upgrade available, which I've always found quite interesting because you never really get that in the NHS. It's not like, oh, I can remove this mole for you, but leave a massive scar, or you can pay me 500 quid extra and I can leave a, you know, little scar for you.
Yeah.
So I've always found that really interesting how you guys can almost.
Let's go on to that in a second. I've got a bunch of comments that I want to get through before people think we're ignoring them. Somebody said that they're a dental student and they still care about their appearance. Thank you for that, ZZZ Lap. Can you guys put easier names to read out? Because and since Phyllis, she's gained a lot of confidence. Talal saying fascinating stuff, guys. My mom's in the comments as well, saying it might be that people don't feel they're changing their teeth. Whitening is just a further than cleaning. Sarah, lots of exposure on these treatments on socials and what's drawing more and more people in. Yeah, I think that's huge, isn't it? We kind of touched on that. Hasnain perspective, regional and cultural aesthetics can be different, and we talked about this with Iran is like the surgical rhinoplasty kind of hub of the world, isn't it?
Yeah, so that's funny that you mentioned that actually. Yeah, so it's a big thing. So even I was saying earlier, plastic surgery is really frowned upon. It's frowned upon in this culture here, but actually in Iran or in South Korea as well, you know, surgical rhinoplasties are really common and they're really cheap as well. So we're kind of talking about it from this westernized look of, you know, culture and what's allowed and what's not really allowed. And all you've got to look at is that recent, you know, social media hoax that The Weeknd did, where he had a full plastic surgery, and the amount of comments, you know, the amount of hate he was getting. But actually, in other countries, it's really acceptable. To get a surgical rhinoplasty, it's, you know, it's kind of almost moms pay for their daughters to get treatment done like that. So it's not a huge taboo, and that's the kind of thing that I always find interesting, how different cultures have different things that they allow and things they don't allow. And I always wonder where it stems from. And how it gets from.
It's moms buying it for their daughters. Maybe it's just they want them to have an easier life, and I don't know whether people are going to like to hear that, but I mean, guys are very shallow at a certain point, you know, when we're choosing a partner, and if someone's more, should we say, has more options, they're gonna pick the thing that kind of piques their interest the most. And maybe they're thinking, well, I want my daughter to have an easier life. I'm not saying that's right or wrong. I'm sure lots of feminists will very much hate what I'm saying there, but maybe that's a thought process in those cultures about that sort of thing. Sarah's saying you may open better opportunities if you look a certain way. And some cultures celebrate diastemas and so on. Most aesthetic treatments work around gold proportions based off Hollywood smile. Yeah,
I mean, there's a lot of truth in that. So, you know, a lot of work that you're trying to do is when you try and enhance someone's face, you're trying to bring it closer to the golden ratio. That's one way you can do it anyway. Not the only way, but, you know, that's one common way that people try and do that. And so there is a bit of science behind it as well. And what you're trying to do has some kind of, you know, thought process, and not just kind of going rogue. You're trying to correct proportions. You're trying to make the thirds match as you normally do. And so, you know, you might even make a chin slightly longer if it's a bit shorter. You know, these are the kind of things you're trying to think about. So yeah, that's definitely a lot of truth in that.
Anissa, who bought a badge earlier, thank you for that, has said, I think people need to be educated that the world of aesthetics has improved fairly in the past few years, and there's nothing to be ashamed about getting, you know, treatment that can improve looks and boost self-confidence.
No, definitely. I mean, a lot of people that, I'm sure the same in dentistry, the best kind of clients and the happiest clients are always the ones that say, you know, I feel so much better. I feel so much happier after this treatment. I'm always really careful with that because you don't want this to be your only source of self-confidence. It needs to be an addition to that, and it's kind of like the icing on the cake almost. But yeah, there definitely isn't. There's a very fine line, basically. There's a really fine line where it's good and it's healthy and it's a nice boost before it gets too much, and that's almost your only source of confidence is fillers.
Yeah,
And
rolling
that's
back to
where
the versus dentistry thing with the white fillings and the metal fillings, again, it comes down to that clinical kind of, I think, down to the resources available. For me, doing a metal filling properly will take maybe 15 to 20 minutes. Doing a white filling is going to take twice that time. So maybe part of it is again down to, we've got lots of people to treat on the NHS with a limited budget. How are we going to see the most people and get them disease-free in the quickest and most affordable way? So that's probably where that would come from. Not quite the same as like scars, as maybe you were saying, but it is kind of valid because, if you do things to a higher standard earlier, you have fewer problems further down the line. But that would require a complete overhaul of the NHS dental system, unfortunately.
Yeah, no, I just find it like, in medicine, you as a doctor or whatever, you can't send somebody to your own private clinics almost. It's really frowned upon and almost quite, you can get in a lot of trouble for doing that kind of stuff, for kind of selling your own services. And you can't pay people to sell your services for you. So if you're a private knee surgeon, you can't go around all the GPs and say, here's 10 grand each, send all your knee patients to me, because it's against the GMC guidelines, basically.
Yeah, if you want to do that, you just go to America. You're cool. It's all good.
Yeah, so I don't know how it works. Like, are you guys allowed to like kind of upsell your patients when they're in front of you? Is any guidelines around that? Can you get in trouble for doing it too much?
Technically, you're not allowed to say NHS is any worse than private treatment, but at a certain point, that becomes kind of like it kind of becomes like, well, you've got to give the patient all the options at the same time because, okay, well, a certain crown which costs £1,000 is certainly better than another type of crown where you're whipping off a load more tooth structure. So, you kind of got to work your own way there, and it's very vague, I think, the actual rules around that. But it's a difficult one, and that's why a lot of people do tend to do one or the other, and people are doing a bit of both. Sometimes just do what's best, even if it kind of bites them in the pocket a bit sometimes. Thank you, Amber. I can see you've hit the like button about 6,000 times. How many of us take the time to tell our patients how getting veneers or fillers is a lifelong expense, not thinking about the money? That's a really good point. Will we normalize aesthetics, or will we normalize embracing yourself?
I think that's a really good question, and I don't think there is a right or wrong answer there because everyone wants to. I think everyone should embrace themselves and be happy with who they are, but at the same time, there isn't kind of you also. I don't think there's anything wrong with trying to be the best version of yourself, and if that means doing small tweaks here and there for that little bit of extra self-confidence or whatever, there's I personally don't think there's anything wrong with that, and I kind of think it fits in the line with almost looking after your skin through doing other stuff and not smoking and trying to be the best version of yourself, going to the gym, eating healthy. This is just another version of kind of doing that. I do, like I always say, think there's a fine line when you can go too far, and that's where you've got to be careful for. But actually, if you're just doing it to enhance yourself a small amount and trying to be the best version of yourself, definitely I don't think there should be an issue with that. But I think it is really it's a really controversial topic because I would never say, and I'm just like you. If someone says to me, Shaan, do I need cheek fillers? And I hate that question because the answer is no. Nobody needs cheek fillers. Nobody needs lip fillers. Nobody needs Botox. Yeah. It's almost kind of it's a question of would you like it? Do you want it? Do you think it'd be right for you? Are you willing to kind of will it suit your face? That's another question. But nobody needs it. Are you aware of the risks? Are you aware of the benefits? Those are the real questions that you should be asking.
What doing for you is almost the question they have to answer.
Exactly. Yeah, exactly. One thing I wanted to move on to this question, because the little chat we were having about taboo and aesthetics is kind of,
Did we do men versus women yet before you start?
well, yeah, no, that's what I was going to talk about. Like,
Yeah,
talk
yeah,
about
go.
kind of
That's what I
the
was thinking as
change.
well.
So, like, for example, there's a huge change recently for, I would say, for men. You know, the metrosexual man, they say nowadays. You know, you kind of look after yourself. You know, you shave any excess hairs. You know, there's a lot of kind of skincare for men nowadays, makeup for men nowadays. It's becoming a bit less taboo, and it's kind of all changing now. Changing as well. There's a huge change in it. What do you make of that? What's your opinion on that kind of that change in society?
Again, I think it comes down to that self-care thing. Um, and for me, and I don't know if this is controversial or not, I would say, well, if you're thinking about your aesthetics, let's take as a whole holistic sort of approach. I would sort of say, well, this is all about self-confidence and how you feel about yourself, right?
Mm-hmm.
Well, I would be saying things like, well, are the things you're eating to start with, you know, are those, like every time I have a pack of crisps, you know, when you're on the motorway and you stop and you have a look around, you go, oh God, there's absolutely nothing that I'm fancying right now. So you just pick up a pack of Walkers. Inevitably, half an hour later, I feel awful, right? Same thing if I have fried chicken. Within an hour, my face feels greasy, that kind of thing. I think it's a lot of little steps like that. Okay, well, that doesn't make me feel good, so stop doing those things as well. Am I exercising properly? Well, at the moment, I'm a little bit of a cripple, a bunch of injuries, so it's a little difficult for me at the moment. But those things, are you physically fit? Are you exercising well? Because that inevitably changes how you look. There's a really good subreddit actually, which I kind of like to go on to get remotivated every now and then, where it's called Lose It. I think it's called Lose It, and it shows people who've gone through big journeys of weight loss or weight gain for the people who've come over things like bulimia and anorexia. And you can see there, from an aesthetic standpoint, people's faces change with the amount of water and sodium in the face, and also fat that reduces from the face. So if you're thinking about aesthetics, all those things come into it as well. Skincare, you know, putting SPF and moisturizer, all those things. So you're kind of talking about metrosexual or whatever, but all those things are the same thing. I wouldn't recommend somebody go in, you know, oh, I just need to feel, you know, whatever, and go straight to injectables, for example. I don't know if I'm just rambling there. Does that make sense?
No, I think there's a lot of truth in that. You know, and I think it's not too different. You know, men nowadays were exposed to, you know, lots of six-pack abs everywhere you look on social media, everywhere you go, everyone's kind of in the best shape.
You just got to work.
Well, look, there you go. So, like, you know, there's men in general are kind of having that same social pressure as women used to have kind of 10 years ago, in terms of you've got to be big, you've got to be muscular, you've got to take care of yourself, you've got to have good style, good fashion. So I don't think men are immune to that social media pressure. And I think that's where we're seeing that change. You know, people want to go to the gym, people want to be in good shape. There's a lot of guys nowadays that do a lot of waxing. Laser treatment for men is a huge industry at the moment. You know, shoulder hairs, back hairs. You know, it's really common. Like men, like you almost say most men nowadays will shave, like, trim a monobrow down, you know, and just clean up a little bit. It's really common now. And self-care for men is a huge thing. And I don't think it's like very much different to women, really. I think it's, you know, it stems from the same place of social pressures, people wanting to be the best version of themselves, people wanting to gain a bit of self-confidence. And again, I don't think there's much wrong with that either. I do think there's, no, I think it comes from a good place sometimes. You know, people
I think there's levels to that game, though, isn't there? There's
100%.
Going too far, and then there's doing it right, and maybe, you know, then that's where you need someone to go, you know, hold on, mate. You know, you don't need to, I don't know, get your jaw broken in 4 pieces and then move it just for 1 millimeters wideness or whatever. You know, people breaking their shins to get slightly taller. I heard about clinic people are doing that.
Well, look, I think it's really interesting, and I think the most important thing, which is why I say to people, look, you don't need to come to me for treatment, but one thing I will recommend to everybody is go to somebody trustworthy. And the way you can tell they're trustworthy is check their portfolio, but speak to them. Because when you speak to a practitioner, you'll get an idea of whether they're trying to sell you everything under the sun or whether they're actually being honest. And the way you can tell a practitioner is honest, if they actually, sometimes they'll say to you, don't need a treatment, because they should be losing a client and losing profit at that point.
Yeah.
But they happily will put the profits to one side to have a client who's, believes in what they're saying. And so that's one of the most important things I always say to people is you need to find somebody that you trust, that you've spoken to, you've seen their portfolio, you've seen their kind of, even checking out, how long, their qualifications is fine and good, but that's just a start. That's just a sieve where you start with. You've got to find someone you trust and isn't there just to scam you. And that's one of the reasons why sometimes it's actually quite a good idea to go to somebody that's not their only job, because you'll almost certainly know that they're not reliant on this for the money. And it's another reason why, again, it should give you trust in them that they're not trying to oversell or upsell everything they can under the sun. You need 10 treatments, because for them it's about having a happy client who's a walking advertisement at the end of the day. Every client I treat is a walking advertisement. So that's kind of my advice for most people is, how do you get that balance right for self-confidence and going too far? It's by having good friends and a good practitioner and an honest practitioner.
No, I definitely agree. Anissa has got another comment. She says, sometimes you need to understand that can't improve condition with just topical stuff. Sometimes you do need something a little more invasive, which, that's fair enough. And Hasnain's saying there's therapeutic Botox as well. So there's a lot of different reasons for these things.
I don't think kind of therapeutic Botox, I think that's not related to this talk.
No, it's the whole other side. We're talking more about aesthetics as opposed to other uses of these, materials.
Because people say, Botox can be used for migraines and, bruxism, I'm sure you guys know. But then at the end of the day, that's almost a medical reason. And the aesthetics is a side effect, like a happy side effect almost. So, I think that's slightly different.
Yeah, I think a lot of this comes down to the marketing, doesn't it? How these things are portrayed. And again, we were talking about... was it men and then women, the differences there. And I think maybe the difference between the men and the women is a lot to do with, well, actually, there's a group element when girls are involved in certain things, and men can kind of get away with a little more socially than girls can. I'm sure you've watched, classic films or whatever about, the high school environment and the cliques and stuff like that, where that can be more damaging to a girl's social relationships, if they're looking different, wearing different things than a guy's is, because, guys just go, all right, we're just going to go play football, for example, and everyone plays and everyone does whatever, whereas girls is much more social, it's more mental sort of things, more of a, so it's all about the friendship groups as opposed to what you do and how good you are at things.
Yeah, I mean, I think moving back to the social media advertising side of things, I think the way that advertisements need to be done is really important in this industry. Because if you start, and this is one thing that I always look out for with other companies and, aesthetics in general, is that whenever you start kind of putting pressure on your clientele, that's always a serious red flag for me. So if you're, for example, saying, you need this treatment because otherwise you look bad, or this is what's going to finally make you look good, that's poor advertising, and that's kind of adding to that social media pressure, which you shouldn't really be doing, I think. And that's kind of how, if I was a customer, I'd be analyzing pages that say the honest truth of aesthetics. Here's the good things that you can have, but actually here's all the bad things that happen as well, and you've got to be prepared for it, and you've got to be willing to take that risk. And if you're just kind of selling this dream, and I know a lot of pages that sell these perfect lips and, talk about, every case is the best case we've ever done, which is fine and it's good and it probably sells really well, but actually sometimes it can be a bit misleading. And I think aesthetic treatments, injectable treatments, needs to be slightly medical as well. It's got that medical aspect to it. And so you need to have that, informed consent. And the way you do that is tell people the pros, here are the cons, here's my work, here's sometimes things go wrong, but this is how we can correct it. What do you think? That should be kind of that should be the approach, in my opinion.
Playing devil's advocate there, would those people not say, well, that whole idea of social media marketing is to get people in the door, we do all that kind of stuff while they're in the building?
No, I mean, look, I do see the value that people do in doing that, like selling the dream, really, because that's how you get clients, right? That's the way. But then and they probably, are doing, incredible numbers, etc. And it's great, and I do see a lot of value in it for them as a business. But I'm just thinking more from the client's perspective. Like sometimes you could be walking into a procedure expecting this result, although, if you did a little bit more reading around it, actually, did you know that there's a risk of a vascular occlusion? Did you know that the risk of bruising and swelling? I sometimes get clients messaging me, Shaan, I've got a wedding this Friday. Can you do the treatment on Monday? And that's really risky. We shouldn't be doing treatments like that because there's a risk of bruising, swelling, pain. Imagine the wedding photo is completely ruined just because you didn't do enough research on your practitioner. So yeah, I always think an honest page is a lot more value in that to the client. Ultimately, that's who you're serving than a page that kind of sells the dream. That's just my opinion.
We're all about opinions here, right or wrong, who knows. What's the best age to start Botox?
So look, that's another question.
Impossible question, isn't it?
Impossible question. There is no right answer to that. If I said everyone needs to start Botox from 20, it's a stupid thing to say because it's not true. So again, it depends on the person, depends on what their requirements, what they're hoping to achieve. Really, is a real question. If you're trying to delay aging and delay wrinkles forming, early 30s is a good idea. If you're trying to, if you really don't want to get wrinkles and you've got high tendency to form wrinkles, certain skin types do. If you get sunburnt a lot, etc., spend a lot of time in the sun, then you should get Botox slightly earlier. But it really depends on what you're trying to achieve, and there is no right answer. It's really personal. Some people shouldn't get Botox. They should only get Botox in one area and don't need to get it everywhere. Some people should get Botox in lots of areas. There is no right answer, I'm afraid. It's what you're trying to achieve.
Yeah. Going back to the marketing, which is what we were talking about before the question, well, guys, first of all, me and Shaan have shot a few things, for your business, haven't we? What was the thought from your point of view when you were setting these things up? And obviously I was directing a bit as well. What were you trying to portray?
And I think we had a long chat before we kind of started this as well. And the thing that we were trying to do was the patient journey. We were trying to go through what is a client worried about right at the start of treatment. What are they scared about? What are their biggest fears? Go through kind of what to expect on the day, and then have the treatment, etc. Sometimes I know people don't like needles, but sometimes showing the treatment can also be really good because it can almost sensitize people to it and they know what to expect. And then I'd like to show them after the treatment and how those initial fears were kind of alleviated and were kind of overexposed in their head, really. So that's kind of what I was trying to do, but also a realistic approach, not really hiding stuff, not kind of sugarcoating stuff. A lot of the videos we talk about pain, we talk about bleeding, we talk about risk of infection, we talk about, VOs, vascular occlusion. So yeah, that's kind of my take on it. I probably am leaving kind of a lot of clients on the table by, not selling the dream. But I do think that, clients trust you more when you're honest. And that's probably the most important thing.
Yeah, no, I would tend to agree. I think it was at least to put the information out there so that people can go through all your videos to see what can go on. Maybe celebrate the dream as well, because I think you probably did hit that balance again with all of these things. This entire maybe conversation is all to do with the balance and not taking things too far in either direction, because sure that things can go wrong. Things can go wrong in every procedure, but more often than not, things go right. And we have the same issue with root canals and endodontics. For some reason, most patients in Britain seem to think that root canals are going to hurt and they don't work, which, all the evidence is completely the contrary of that. You're looking at 85% plus success rate from a non-specialist, which is pretty good, you know. And if you look at the state some of these teeth come in, you'd be like, well, that's pretty impressive, really. So again, it's that portrayal and, you know, Chinese whispers. That's what you have to fight against, isn't it?
Yeah, no, definitely. And I think, like, if I was a dentist and I was going to talk about root canals, I would tell people that information. I'd show them studies and I'd say, you know, 85% of people think root canals hurt. Actually, the evidence is 85% of cases, you know, work well the first time and don't need to have retreatment. Or you could even sell the honest truth and say, you know, 85% of times if you went to a general dentist, it would work well, but actually a specialist, 95% of the time it works. So that's what you're paying for. You're paying for that risk reduction, aren't you? And that's why you can charge a premium. So I think stuff like that, there's a lot of value. There's a lot of value that people don't really talk about, because I don't think clients are as stupid as, you know, as we'd like, you know, people think they are. I think they do their research, they look around and they understand facts. And so if you tell them honestly and openly, this is what's going to happen and this is what you're paying for, this is a product we use, if anything, they just buy into you more and they buy into the dentist a lot more. That's what I would do.
I think there's fear when it comes to dentistry as well. Some, you know, there seems to be a lot of irrational fear, which is universal for some reason, you know, about fear of, I think it's that close personal sort of in your mouth, as opposed to people that aren't maybe so scared of aesthetics, because it does feel like getting well, maybe not for girls, but getting a beard trim, but, you know, it feels like getting a beard trim or something, you know, it's outside, no one's, you know, yanking your lips and fighting your tongue, and, you know, you're not gagging on anything, you know, impression material and stuff like that. So I think we have that as well to kind of contend with. So maybe all these factors come into play.
Yeah, well, even that would be like a huge thing that I would try and target then. So if I was a dentist, I would show clients saying I'm really worried about the pain beforehand, and then show an after shot saying actually, and honest after shots, you know, it wasn't as painful as I thought it'd be. It felt like somebody was tapping, I didn't feel any pain. Or you could show them the next day and be like, you know what, I didn't even have to take any paracetamol the next day, or stuff like that scares people the most. Or, you know, I was able to go to work straight after, and I do this for a living or whatever. And just kind of addressing those, understanding what your client's fears are and addressing it head on is probably the best technique.
Yeah, I mean, I tend to agree. I think when you come to do that kind of marketing, if we're looking at it from that standpoint, you have to have the right setup. You know, you probably don't want the dentist behind the camera going, "How was it then?" You know, like, because it's fine, don't worry, hands up.
It's got to be authentic. It's definitely got to be authentic.
Yeah, you're going to have somebody else, you know, who's separate, you know, kind of ask those questions, which is, I think, why it works quite well for us, because I kind of did that for you, didn't I? Whilst faffing around with my cameras and stuff. So we kind of got that little bit of separation between the clinician and the person who's asking how it went, what do you feel, all those kinds of questions.
Yeah, no, I mean, I'm quite rationing out the content we did that day, because, you know, obviously we're not treating clients for a while, so because of lockdown, so I'm just kind of slowly dripping it out. But yeah, that whole video will be seen shortly on the page.
Have you put either of them up, or is one of them?
No, I've kind of just done snippets of them, but I'll do a few more pretty soon, I think.
Yeah. Guys, if you do want to see the full videos, they're on my personal page. So
yeah, give Jabir a follow. That's what I'll definitely say. If you're not following them already.
So where if for the guys who are, you know, local to West Yorkshire and London, actually, where can we find you, man?
Yeah, so good question. So we are currently obviously closed because of lockdown, and I know people love doing aesthetics behind closed doors, but I'm really against it. I don't think it's an essential treatment, and so we are kind of being official and being closed.
You
Boris
just like
Johnson,
beat up, don't you? You like a bit of a chill.
But Boris Johnson has said, you know, we can open from April 12th. So if everything goes ahead as planned, then hopefully we can open from then. We are planning on opening in Bradford, Leeds, and we are going to be holding clinics in London as well from April onwards. And yeah, probably East London, Essex region, which is quite popular. So yeah, we hopefully will be reopening with a bit of a bang, which should be interesting and fun. And yeah, that's what we're going to be doing.
Somebody's asking, do dentists get paid better than doctors? That's a whole other talk.
Yeah, I think that's a short answer. Yes, probably. Um, but yeah, I think yeah, it depends which country you're in as well, I guess.
Yeah, it just comes down to specialty. It comes down to how much
Mm,
you're working,
mm.
hourly rates, all that kind of
And
thing.
longevity of career as well. So like, a lot of doctors probably in the early days don't make a lot of money, but then as they kind of specialize, orthopedic surgeon, for example, can work fully privately, and then they start earning, in their early 30s, late 40s and early 40s, they can earn a lot of money,
Mm.
very quickly. So it just depends, what specialty you're comparing. It also depends what you do, as well. So if you're a general dentist versus like a doctor who's gone
Specialist
into
stuff.
buying practices. Yeah, so it really depends.
Yeah, I think that's a whole other conversation there.
Yeah.
Guys, if you're enjoying these, make sure to, well, basically the replay for this is going to be on YouTube. So head over to YouTube and subscribe. Link is in the bio to that. Make sure to
Mm.
head over and follow Rejuveo Aesthetics, which is Shaan's professional aesthetic page. I've also been designing loads of mugs this last couple of days and hoodies and a couple of other things. So if you would like to support the channel or this Instagram plus YouTube and everything that I'm doing, and also have something in your pocket, head over to the link in the bio for that, and let me know what you think of designs and prices. I'm trying to get the pricing right, so do let me know. I do need
Do you
someone
know
to
what,
test out the checkout as well. So if somebody needs to buy something.
Jabir, I
Uh,
was gonna say I found your those leggings that you were doing with the teeth on really good. I think they're gonna sell really well. So,
are you going to
but
wear
you've got
some?
to model them. You've got to model them first for
Sweet.
me, and I'm going to see them.
It was requested by someone, so I put the design on that. So basically, I put that design on the mug, and someone was like, "Oh, they'd be really good on like yoga leggings." So like, I think they have it. So
Yeah.
I just dropped it on. Who knows when everyone's actually going to buy them, but we'll see.
I mean, yeah, if anyone buys that, you've got to send a photo to Dentist of Insta. I definitely want to see that.
Yeah, yeah, we'll hopefully get some people wearing the merch pretty soon. I can see aspiring DH in the comments. Make sure to let me know that you've got your loops from what are they called, UK loops. There, you on the loops. Anyone else that I recognise in the house before we head off? Dr. Magaria, speak to you soon. Hopefully, Amber, thank you for joining us. Yeah, man, I think that'll be good. We should do this again and maybe tip into some different topics, because I think we could argue quite easily and not fall out.
Yeah, yeah. No, 100%, 100%. Yeah. Whenever you next want me on the show, I'm more than happy to come on.
Cool. Yeah, guys, it's been a pleasure having Shaan on. Make sure to go follow Rejuveo Aesthetics. Make sure to head over and check out all those bits and pieces that I already listed off. Actually, make sure to go and watch a couple of hours of the YouTube videos. I'm very close to getting monetized on YouTube, but it's all about watch hours, guys. So please do that as well. And I will see you guys next time. I will.
Cool. See you later. Take care. See you later, Jabir.